Hello, Pharmaceuticals Part 3, and in this part, we are going to see the classification of drugs on the basis of their therapeutic action. And according to their therapeutical action, the drugs are classified in the following groups, that is, CNS or psychopharmacological agent, that is, central nervous system agents or psychopharmacological agents. Then pharmacodynamic agents or drugs. Then third one, chemotherapeutic agents or drugs. This agent and drug, these two words are used with the same meaning. And fourth class is metabolic diseases and endocrine function related drugs. So let us see one by one. First is drugs acting on the central nervous system. The central nervous system in human consists of brain and the spinal cord. It is able to control the thought process, emotions, senses. These drugs can either stimulate or depress central nervous system. The different types of CNS drugs are as given below. First one is anesthetics. The term anesthetic is derived from the Greek word anesthesia, means insensibility or lack of feelings. The drug which produce insensibility to the vital functions of all types of cells, especially of the nervous system, are known as anesthetics. Anesthetics produce temporary insensibility to pain or feeling in the whole body or a particular organ which has to undergo the surgical operation. They further classified as general anesthetics and local anesthetics. In general anesthetic, whole body is under anesthesia, and in local anesthetics, the organ or the part of the body which is to be done by surgical operations, that part or that body or that organ is anesthet given anesthesia, and only that organ becomes insensitive to the surgical operations, and that is known as local anesthesia. The effect produced by anesthetic is reversible. This is very important. Whatever the insensibility produced by the anesthesia is reversible. That means after some time the body regain its normal condition, normalcy. Its sensitivity is regained, which means the affected organ returns to the normal state as soon as the concentration of the drug is decreased in the body or in that organ. Second type is hypnotics, the drug which produce drowsiness, sleep, to reduce restlessness and emotional tension, are known as hypnotics. The patient cannot be easily awakened until the effect of the drug wear out. These are CNS depressant. Hypnotics are CNS depressants. phenobarbital, diazepam, nitrozepam, oxazepam. These are some of the examples of hypnotics. Sedatives, the drugs which reduce restlessness and emotional tension without producing sleep, are known as sedatives. Hypnotics and sedative work in the similar manner, only the difference is hypnotics produce sleep or drowsiness. On the other hand, sedatives do not produce sleep or drowsiness. The sedatives are important for the working people. If they take that medicine and they have to work, then sedative is very important. These decrease activity, excitement of the patient and calms the anxiety by producing mild depression of CNS without causing drowsiness or sleep. This lead to natural sleep, that is phenobarbital, methyl phenobarbital, veronal, etc. From the above definition, it is difficult to draw a definite line among hypnotics and sedatives. Usually, their action varies with the doses. For example, phenobarbital, which is we have seen in hypnotics as well as in sedative. But what is the difference? Phenobarbital in small doses, such as 25 to 30 milligram, acts as a mild sedative, while in higher doses, 100 milligram, it acts as hypnotics. This is the difference. Then anticonvulsants, the drug which are used in treatment of various types of epilepsy, are known as anticonvulsant. Epilepsy is a disease which arises due to disorders of central nervous system. This disease is characterized by convulsions or other abnormal body movements which are accompanied by loss in consciousness. This is convulsions. For example, phenobarbital, thiopentone sodium, phenytoin, these are the examples of anticonvulsants. CNS stimulants, the drugs which increase the activity of various portions of central nervous system, are known as CNS stimulants. Many forms of illness, both mental and physical, involve depression of mood or normal mental activity. In such circumstances, CNS stimulants are helpful to improve mood. For example, xanthine, caffeine, theobromine. These are examples of CNS stimulants. Analgesics, the drugs which are required to produce analgesia, are known as analgesics. That is, which gives relief from pain. We call them as painkillers. Increase the capacity to tolerate pain without loss of consciousness, are known as analgesics. Narcotic or opioid analgesics and non-narcotic analgesic. These are the two types of analgesics: narcotic and non-narcotic. In narcotic, morphine, pethidine, and in non-narcotic, aspirin, aminopyridine. These are the examples. Antipyretics, the drugs which bring about the lowering of the body temperature in fever, are known as antipyretics. They do not have any effect on the normal body temperature. Paracetamol is antipyretic. These are some of the example. Phenacetin, antipyrine. They lower the body temperature in case of fever of the patient. And eighth type is anti-inflammatory agent, the drug which are used to diminish or reduce, inhibit inflammation. The drugs which are used to diminish or reduce or inhibit inflammation and the pain arising from it are known as anti-inflammatory drugs or anti-inflammatory agents. Diseases in this class are sometimes called connective tissue disease of joint, bone, heart. They include rheumatoid arthritis, rheumatic fever, osteoarthritis, and indomethacin, ibuprofen, diclofenac. These are the examples of anti-inflammatory drugs. And anti-inflammatory drugs are also of two types. First one is non-steroidal anti-inflammatory drugs and second one steroidal anti-inflammatory drugs NSAID and SAID. Then second main type of drugs, these are pharmacodynamic agents, the drugs which affect the normal dynamic process of the body, especially the blood circulation. The drug used in the treatment of allergic diseases, gastrointestinal system disorders, are known as pharmacodynamic agents. The different types of drugs are as first is cardiovascular agents or cardiovascular drugs. The drugs which have direct action on the heart or other part of the vascular system so that they modify the normal output of the heart of the distribution of blood to certain parts of the circulatory system are known as cardiovascular agents or cardiovascular drugs. And in cardiovascular, this is the cardiovascular agents is the first type. In cardiovascular, there are subtypes, and first subtype is antihypertensive agents or hypotensive agents. The drugs which are used to reduce BP, blood pressure, and its accompanying symptoms are known as antihypertensive or hypotensive. Hypo means to lower, hyper means high. Anti-hyper, that means against the high blood pressure, they work. Then cardiac glycosides. These drugs have direct action on the heart and are used for the treatment of congestive heart failure, cardiac arrhythmic condition, cardiac glycosides. Then third subtype in cardiovascular agents, anti-arrhythmic drugs. The drugs which are used for the modification of cardiac rate and rhythm are known as anti-arrhythmic drugs. Quinidine, procainamide, these are the examples of anti-arrhythmic drugs. After cardiovascular, second class is anti-allergic agents. Number of substances derived from variety of such as foodstuff, animal hair, pollen grain, dust particles may cause allergic reactions in human being. And these substances are known as these are antigens. These may bring about the release of chemical substance histamine in the body. Its release bring about numerous physiological effects and this is the condition of allergy. So drugs used against allergic condition are known as anti-allergic agent. In anti-allergic agent, there are also subtypes, and first subtype is Antihistamines. The drugs which are used to treat variety of physiological responses of the histamine are known as antihistamines. The source of histamine in our body is the histidine. This is the structure of histidine, a naturally occurring amino acid. It on decarboxylation, that is minus CO2, it gives histamine. And the allergic reactions caused by histamines are it decreases blood pressure by dilating the capillaries, increase heartbeat rate, it causes edema, it acts on smooth muscles of lungs, produce bronchiolar constriction, it causes ulcer, etc. These are the reactions, allergic reactions. Anti-ulcer or gastrointestinal, antispasmodic, and anticholinergic agent. If acetylcholine is liberated in excess amount, it brings about some undesirable physiological effects such as spasms of the stomach, intestine, heart, blood vessel, excessive gastric and salivary secretion, sweating, and meiosis. The drugs which are able to block the action of acetylcholine are known as anticholinergic drug. Some of the common disorders of gastrointestinal tract are loss of appetite, obesity, vomiting, diarrhea, constipation, peptic ulcer. The drugs used in the treatment of these disorders are commonly known as gastrointestinal agents. And atropine, hematropine, pallidine, mebivarin, these are some of the examples of gastrointestinal agents. Third main type of the drug, depending on the action, therapeutic action, these are chemotherapeutic agents. Drugs which are used in the treatment of diseases caused by germs or microbes, that is bacteria, protozoa, virus, fungi, are known as chemotherapeutic agents. Chemotherapy means treatment of disease by chemicals. These agents are specific in their action. They are selectively more toxic for the invading organism than for the host. The different chemotherapeutic agents are anti-malarial, those drugs which are used against malaria. These are known as anti-malarials. Anti-tubercular and anti-leprotic agents. So anti-tubercular, their names indicate that which is the disease against they are used. So against TB, tubercular condition, anti-TB drugs, anti-tubercular. And leprosy is the disease against which anti-leprotic agents are used. Then third one, anthelmintics. Parasitic worms are termed as helminths. Helminthiasis is the disease caused by infestation with parasitic worms living in the alimentary canal or in other tissues of the host. The main parasitic worms are roundworms, hookworms, threadworms, stepworms. They may cause loss of blood, nutritional deficiency, and other allergic reactions. The drug which are used to kill or remove the parasitic worms from the alimentary canal or from the body of the patient, these are known as anthelmintic agents. Anti-amoebic drugs. The diseases caused by amoebic species like amoebic dysentery. These drugs used against amoebic diseases are known as anti-amoebic drugs. Amoebic dysentery caused by Escherichia histolytica. And fifth is organometallic compounds. These are organometallic compounds such as arsenic, bismuth, mercury, gold, antimony, silver, copper, etc. have been used in the treatment of protozoal diseases. Acetarsone in the treatment of syphilis, amoebic dysentery, arsenamide, stabelnic, mercurial, diuretic. These are some of the example of organometallic compounds which are used as drugs. Sixth is anti-neoplastic. Anti-neoplastic, or these are also known as, the medical term for cancer or tumor is neoplasm, means relatively autonomous growth of tissues. So anti-neoplastic agents may be called as anti-cancer agents. The drugs which are used in the treatment of cancer are known as anti-neoplastic agent, that is chlorambucil, mustine. These are examples. Antiviral agents. Viral infections are treated with the help of antiviral drugs or antiviral agents. Antiseptic and disinfectant. This is the class. Drugs used against infections, they are disinfectants. Antiseptic and disinfectant are the chemical agents which are used to destroy or inhibit the growth of pathologic microorganisms. Antiseptic are anti infective agents which are applied to living tissue. These are bacteriostatic, while disinfectant are bactericidal. These are applied to non-living surfaces. Phenol and derivative, crystal violet, mercurochrome, etc. are the examples of antiseptic and disinfectants. Then ninth class is sulfa drugs. Sulfonamides, this is the one class. These are synthetic chemotherapeutic agents containing SO2 NH2 group in their structure. Sulfa drugs are effective agents against bacterial infectious diseases. They are active against gram positive and gram negative bacteria, cocci, bacilli, and protozoa. At present, sulfonamide have been largely replaced by antibiotics such as prontosil and related drugs. Antibiotics. These are the drugs which are used, the chemical substances produced or derived from living cells which are capable in small concentration inhibiting the life process of even or even destroying the microorganism are known as antibiotic. That means they are working against living causative agents of diseases. Penicillin, amoxicillin, ampicillin, chloromycetin, these are the examples of antibiotics. And the last class is metabolic diseases and endocrine functions. It includes variety of drugs which are not classified in the other groups. Anti-inflammatory diabetic agents, that is, drugs which are used against the diabetic condition. Diabetes is caused due to the deficiency of effective insulin, a hormone secreted by beta cells of pancreas. The normal blood glucose level in human ranges from 70 to 100 milligram, and hyperglycemia develops when blood sugar concentration is more than normal concentration, while hyperglycemia and hyper means more and hypo means less or low, develops when the blood sugar level falls below the normal range. The drugs which are used in the management of hyperglycemia or hypoglycemia condition are known as anti-diabetic agents. So any diabetic condition, if they are, and the drug effective against diabetic condition are known as anti-diabetic agent. Drug affecting the immune response. Immunity can be defined as the ability of the body to neutralize and eliminate the pathogenic microorganism and their toxic effects and toxic products. Immunological agents are the drugs which produce active or passive immunity and are used to prevent or to modify certain infectious diseases. Vaccine. All vaccines are examples of drug affecting the immune response. Drug used in the endocrine functions. The endocrine glands consist of groups of highly specialized cells localized at different sites in the body. These glands synthesize and discharge their secretion directly into the blood. These are known as hormones, which control various metabolic processes: pituitary gland, thyroid gland, parathyroid gland, adrenal gland, pancreas, testis in male, ovaries in female, are few examples of endocrine glands. The deficiency of hormone causes physiological diseases, which can be cured by giving the particular hormone. For example, thyroid gland secretes thyroxine hormone, which controls normal metabolism of tissues of the body. When the thyroid gland is enlarged due to the deficiency of iodine in food, a disease called goiter develops, which can be treated by giving iodized salt. Hypothyroidism, lesser secretion of thyroxine, causes mental illness or dullness, dry skin. Hyperthyroidism, excessive secretion of thyroxine, causes nervousness, breathlessness, eyes may be pushed forward, and the drug used in the endocrine function example is carbamazole. Thank you.